Hi there, Unite for a Community. Sue Weldon here, and today is the Giving Tuesday, that global day of giving. And it is so important for us to introduce you to those that work with us hand in hand in the community. And that medical community are key players, right? They have the pulse of the patient. They understand how we work collaboratively. And today I have the honor of bringing in Dr. Taiwo. She actually was a part of our pilot back in 2021 when we first went across the nation with 103 metastatic breast cancer patients, and has watched us grow. So Dr. Taiwo, thank you for coming out and just being a part of this day and giving us your perspective as a physician, because when we started with you, we were at 100, that we had this pilot, and now we're serving well over 5,000 and really prioritizing our underserved communities, and you really helped us get there. And I'd love to just hear your perspective and how it helps you as a physician with that comprehensive care as well.
No, absolutely. And thanks for, having me, just kind of talking about the service that you guys provide to, patients who really need this service. I work in Brooklyn. Many of my patients are underrepresented, underserved patients who have been diagnosed and living with breast cancer or in the survivorship phase. And a lot of us patients don't have access to some of the non sort of allopathic ways of managing breast cancers. They see us in the cancer center and there's the sort of, whether it's surgery, whether it's chemotherapy, radiation, or whatever is needed. A lot of the supportive care and complementary care that we know now improves patient survival, improves patients' overall mental, physical health, that is, kind of makes the patient whole as they're going through this journey. And so it's been wonderful to have Unite for Her provide this services to patients who traditionally don't have access to supportive services. I'm a strong ambassador and advocate for patients to, in terms of connecting them to the services that you provide. Obviously, I'm a medical doctor. I'm very evidence-based in many of the things that I do and recommendations that I make. And so when we talk about complementary care and we talk about integrative medicine, it's not just something we say is helpful. We actually have science and data to back how that also helps patients who've been diagnosed, who are being treated, or who are living with breast cancer, regardless of the stage, the whole spectrum of early stage to metastatic. So the service has been wonderful in terms of, we know healthy eating and prudent diets are helpful in patients who've been diagnosed and getting treated for breast cancer. And so some of the nutritional support, we know some of the physical support when it comes to bone health, when it comes to acupuncture and meditation and all those things. And these are all very expensive services and many patients can't afford it. So to have the ability to provide the services to this women at no cost is just an amazing service that you provide for women who are living in, who've been diagnosed with breast cancer and being treated with breast cancer, and then particularly for the kind of patients that I'm very passionate about taking care of. These are the underserved and underrepresented patients. And I think just even besides the services that you provide in terms of whether it's nutrition, whether it's meditation, physical activity, those things are very important. But I think the educational programs that you guys also have is amazing. I feel like a lot of patients have no sense of control. Once there's this diagnosis, you're handed over to medical professionals who are now dictating what needs to happen and what the next steps are. And I think some of these programs you have with physicians and other providers really walking patients through what it means to be diagnosed with breast cancer, what it means to be treated with breast cancer, questions to ask, and, sort of advocacy as well. So patients are not in the dark. They're able to get that information in a less clinical setting. And so that support is definitely important. And so I can talk all day about just the importance of Unite for Her and the service that you all provide. And I'm glad that my patients have that. I'm glad that we were, one of your, pilot sites. And obviously you've grown, which is clearly an indicator and a testament to how important and needed the service you all provide is. So I keep up the good work. You guys are doing amazing things. Patients are are happy and grateful. We have a lot of Spanish speaking patients here. They're
Yeah.
very excited to have, this service is also in a Spanish language. It makes a huge difference. So just serving patients on the whole spectrum is wonderful, and that's what we all hope to to attain. So thanks for showing us the way, and I wish you all more luck and support, and I'm always here to be an ambassador in whatever way I can, because I see what my patients
Yes.
what they get from it and how it benefits them.
I know, Dr. Taiwo, you really have been such a good ambassador. I mean, you've been on those speaker series and talking about bone health and breaking it down for our patients, and they are interested, they're savvy, they want to learn more. And when they can get that self-advocacy, all of a sudden they gain control again, right? And they feel like they're doing something and they're getting knowledge, and they're having a one-on-one with you, right, during that time, for that hour that you dedicated that time to Unite for Her, to do that live Zoom recording. And it's important, the collaboration is important. I'm glad you talked about our Spanish community as well, because we worked so hard on that and making sure we represent the culture that we want to serve with our Spanish dietitian, everything in Spanish, our website, our care box, and you helped us get there. So, I know you're thanking us, but we thank you too, because it's such a collaborative approach. You teach us on what is needed and how to make sure we are representing the communities we want to serve. And it's so valuable. And yeah, science and database. So we love being able to shout that from the rooftops. We had a poster at San Antonio.
Oh yes, I saw the poster. I saw the poster.
Yeah,
I was like,
it was
yes.
so good. I know, right? Oh, we're so proud, it's a big deal. And we get all these love notes all the time. We get testimonials like you do all the time about, just the putting the food on the table for your patients. What an emotional release that they were able to have, which helps them mentally, which helps them feel like they can self-advocate. It is just such a snowball effect of goodness that we can provide them and fully fund. So it is a wonderful collaboration that we're able to have with our medical communities, our hospitals, and especially for you guys who are seeing a lot of underserved patients and undersupported patients. So thank you for the recruiting that you do and showing up here today. I know how busy you are. It's a big day for us, right? We can only move as fast as the funds that we can raise, and that's why we like you to hear from our partners. We like you to hear from our community, so you can understand exactly where those funds go, that 100% of it goes right to those that we are serving, and making sure that they are getting the care that they need in a way that's going to help them adhere to treatment, not abandon treatment, adhere to treatment. And that's not easy. That's not always easy, Yeah.
Important work. Well, I hope this continues to grow, and I hope what you do expands, in all cancer spaces, because this is the way of the future. You have to treat the whole person. And I think
Totally.
that recognition of, yes, you are a person with cancer. You're not just a breast cancer diagnosis, and putting that whole picture together and getting some sort of control, I think, is a whole lot of what you do. Yeah, we talk about food and all of that, but
Yeah.
it's a holistic approach.
No. And the patients just say, they trust us when we come in, and they open up, a little bit more, because they have a lot of pride. They might not want to tell their medical community that they can't put food on the table, and then when they tell us, then we can come in and bridge that gap. And then all of a sudden you're seeing them do better, and you're seeing that change. So again, we appreciate you. We appreciate your, advocacy and your willingness to always show up for us. And it's an honor. It's an honor to have you as a partner. So thank you, Dr. Taiwo. Thank you for joining me today.
Thanks for having me. Have a good one.